So I wanted to make a quick informal video, because all of our videos are informal, about the light adjustable lens, because the light adjustable lens is the most advanced, cool cataract surgery implant that we have available to us today. And it works a little differently than most of the other lens implants out there, actually all the other lens implants that are currently out there. So patients ask, how does surgery differ when I get a light adjustable lens versus a normal lens, or a trifocal lens, or an extended depth of focus lens, or a standard lens, toric lens, etc. The surgery is the exact same. So typically in a non-complex case, cataract surgery can take between 5 and 15 minutes, and we do one eye at a time. In some cases we'll do both eyes on the same day, but very often we do one eye at a time. And so the surgery itself is the same, and we're putting in this lens implant called the light adjustable lens into a part of the eye called the capsular bag that held your original lens that you were born with. So when we do cataract surgery, we are breaking up that lens, we're sucking it out, and we are putting this new lens implant in its place. So after the light adjustable lens is in place, when the lens first came out, the patients didn't really like it because you have to wear these really thick, dark glasses all the time to prevent UV light exposure. Now, the lens itself has a UV coating in it, but you still get these cool, relatively stylish glasses to wear afterwards to just prevent excess UV light from changing all the little nanoparticles in the lens and affecting its measurements. Your refraction, or the measurements of your eye after surgery, are not your final outcome. So your vision will be good, it'll be better, but it won't be optimized yet. After the eye's healed for about 14 to 17 days typically, some patients' inflammation can last a little longer, so we have to wait. Some patients we can even start treating shorter. But we bring you into this room here after doing all your measurements, making sure things are fine-tuned, and seeing how much we need to adjust the power of your refraction, kind of like when you get a new pair of glasses or contacts. And we take you into this room right here, and this is the RX light delivery unit. So you put your chin on this machine here, and dial in all these fancy measurements onto this computer, and then you have a painless light treatment that polymerizes all these nanoparticles, all this sciencey stuff, and they actually shift and change the power of that lens. So this is why it is our preferred lens for anyone who's had a refractive surgery before, such as LASIK, PRK, RK, anything that throws our lens calculations measurements off when we're doing our lens calcs to order what size lens implant, because there's a degree of error. So now we can overcome that and optimize it. And patients who even haven't had those procedures before, but they want the best quality, maybe not necessarily quantity as in distance and sharp up close, but best quality vision with no glare, halos, issues at nighttime. They want to have good contrast sensitivity, see the colors very clear and distinct from each other. You will probably still need to wear some readers for some really fine print, but you can get good range, say distance to about your computer screen, without having to do a large monovision offset. We can do a little mini monovision offset and get you a good range of vision. And that's about it. Patients, we have up to 3 adjustments that we can do. So some patients need only 1 adjustment, some patients need all 3. And in between each adjustment, you get to test drive your vision for a few days, even a few weeks if you want. And then we see what you like. You can say, doc, my distance is great, I want a little up close. So then we take a little distance away from one eye and bring it in intermediate. But we want to make that offset so small that you don't notice it with both eyes open. But if you close one eye, then close the other, you might notice a little difference. And that's about it. We do 2 lock-in treatments after that. So you'll have anywhere between 3 to 5 total light treatments. And those lock-in treatments help get you out of those glasses and prevent those nanoparticles from ever shifting from any intense UV light exposure in the future. So yeah, it's one of our favorite lenses to use, especially for our post-refractive patients, but even patients who are just desiring the best overall quality of their vision. If you don't have more than 2 to 3 diopters of astigmatism, or if you've used monovision contacts before or glasses, And especially if you have any retina or glaucoma disease, then you're not a candidate for a trifocal lens, a lens that splits light and can degrade your visual quality, then it is also the best lens implant choice for you. So if you have any other questions about it, you can reach out to our office at any time. And other than that,